We are now live on RCTV and also on Facebook. My name is Brian Howard. I am the town manager. I am joined with our emergency management team. We also have the chairs of both the Randolph Town Council and the Randolph School Committee joining us here this afternoon. I do want to give an update on the COVID-19 testing capacity. As the governor has talked about over the past few days, the number has more than doubled their ability to test, and that we would see an increase in numbers based on that. Randolph has 2 additional individuals that have tested positive for COVID-19. Last night, Norfolk County was at 82, and now Norfolk County is at 129, a significant increase based on testing capacity. In addition, the state, which last night was at 777, is now at 1,159. So we anticipated the numbers would be going up once testing capacity increased. I will now ask our health agent, Jerry Cody, our commissioner, to speak a bit about testing capacity, the process. I think the one thing, Jerry, that I hear, you hear, you see it on social media, people ask, okay, somebody's tested positive. We want to know, when did they get their last cup of coffee at Dunkin' Donuts? When did they last go to Shaw's to pick up necessities? And what we try to indicate to folks, and this has been true across all the municipalities in the state of Massachusetts, is that the standard of contact of which people are notified that they are now in a situation where they need to quarantine for up to 14 days until the test is complete is contact within 6 feet for 15 to 20 minutes while the person is symptomatic. And the safest thing for folks to do is to assume that anyone that they come in contact with could have the virus. Have the 6 feet distance, wash your hands, use the sanitizer if you don't have the ability to wash your hands at the moment. Specifically, don't touch your eyes, your mouth, your nose. I think that's probably the thing I've heard the most is, okay, why don't I get to know where they were? And you would if, in fact, you met that standard of close contact. Jerry.
Agreed, yes. So the whole concept of knowing where an individual got infected, it's really a false sense of security. It's not like it's a foodborne illness where you're tied to a specific location due to a practice of how food is being prepared or anything like that. When we have a person that's infectious, they can cough, they can sneeze, they can exhale. That's how the majority of the disease transmission cases are taking place. Yes, there's a chance you could pick up viruses from surfaces that are not clean. However, we find that the majority of the cases that are confirmed from transmission is from the respiratory process, from somebody exhaling, somebody that's coughing, somebody that's sneezing. So it's really the vaporized or aerosolized droplets that are inhaled or that are touched and then placed in your eyes, nose, or mouth.
I think that's a really important part for folks to know. In addition to that, the governor did reduce the number of folks who can be in a group assembly to 10. The number was previously 25. All the playgrounds in Randolph are closed, but park spaces in particular, Powers Farm, and the walking track. And I want to make it clear, the walking track, we did add, the Board of Health has added some additional signage. We do have one right here in front of the president that indicates that walking, running, or hiking is okay. If you practice social distancing, we know folks want to get exercise during this time frame. However, the pickup basketball games, soccer games, anything where there is that interaction needs to come to a complete stop. Chief Pace, one of the things that the governor announced yesterday was specifically the issue of the stay-at-home advisory, and I think it's important people understand this is not a shelter-at-home order, and the COVID-19 essential businesses. Talk to us about the stay-at-home advisory.
Well, simply the governor has made the stay-at-home advisory. It's still permissible to go out and exercise, take a walk around the neighborhood, or take a run even, go to the walking track or the track at the high school and take a run if you like. Or you can go to a grocery store or a bank. Liquor stores are open. One of our fine restaurants in Randolph that are doing takeout, you're more than welcome to go there. Like you just said, obviously no close contact sports or anything like that, but basically, yeah, people are free to do what they want with the businesses that are open.
And another key component is, and we have had a number of phone calls today from folks who are curious if their business that they work for does meet the standard of essential business. You can go to the state's website. We do have the links on the town website. And if you do have any questions, you can certainly reach out to the Board of Health, and Jerry will reach out to the company and they'll have that conversation. Right now, the businesses that have reached out to us do meet the standard. Plus, if you're not on the list, the governor does have the ability for a business to get on the list and try and explain as to why they would meet that standard. So this is a moving piece. The governor implemented this. We're still waiting to get more information from the state on exactly how we're supposed to apply that here at the town level. At this time, our superintendent of schools, Tia Stavel, is here. I know there's been a lot of moving pieces continuing on the school side. Knock on wood, everything has been going well, but it is a nonstop moving of pieces.
That is definitely true. It's going well. It could be better, but we're working every day to make it better. The first thing I'd like to say is we are really excited to see so many students participating in the online learning communities. Every teacher, every special subject, special education teacher, ESL teacher is working to make these lessons as interesting and as engaging for students as they can. They're trying to offer a lot of support for families. Administrators and teachers are personally reaching out to students who have not logged in yet. We have the list and there are people working on it. We also have our pre-K and RISE teachers and our related service providers that are using Dojo to communicate to those families as well. We started a new tab for special education on our website. The Special Education and Student Services Department shared a letter with families on our website, www.randolph.k12.ma.us. Our Director of Special Education and Student Services will be providing updates to the family on this website as we get more information from the Department of Elementary and Secondary Education. Alpha Sanford, who is the director of this program, will also be holding a virtual meeting with CPAC officers at the end of this week to hear questions, concerns that families have, and just to collect their thoughts on efforts to continue supporting our students with disabilities. So there will be more information coming about that meeting. We are continuing to get more families reaching out for devices. Everyone who replied to the initial survey has received a device. We are going through the list in the order that they are received. If families are requesting devices for students, you must give us your child's name, a contact, either email address or cell number, or a current street. We're having a hard time identifying families who are giving us the first name of a child with no other information. So if you'd like a device, you have to give us that information. Due to a limited supply, we are giving out one device per family. We do understand that that creates some problems with timing, but we are asking families to work with us. We are coming up with devices from every possible place that we are holding them. We're asking businesses. We've had people donate. So we are trying to meet the needs of everyone. If you do not have a device and you feel like your smartphone is in a place that you want to work from, we're asking that you continue to do learning activities such as read. There's lots of educational videos, write. You can communicate with your teachers via your smartphones. The assistant superintendent and I will be personally delivering the next 52 devices that were prepared today by our IT department, who is really working around the clock to make this happen. So we are continuing to identify devices, prepare them to send out to families. So the next 52 people will receive devices this week. Starting tomorrow, Randolph Public Schools will be delivering meals to the 4 sites that we already have listed: JFK, Lyons, Donovan, and RHS. But we will also be going to 5 complexes in the area, residential complexes. So there's Liberty Place, Rosemont Square, Chestnut West, Pasella Park, Avalon Apartments or Print Hills, and Franklin Square condos. The bus will be by the rental or leasing office for all of those sites except for Franklin Square condos. The bus will be at the entrance on High Street. These are not your standard pickup spots like the other 4 schools. The buses will pull up. They will park for about 20 minutes. There's a volunteer from each one of those complexes that will help distribute the food. And then the buses will leave. When they leave, they are then delivering food to families who have transportation as part of their special education services and have a variety of reasons why they just can't access either through wheelchairs or things like that. So they're going to get food. And then again, there will always be food at the 4 drop-off sites. So if you don't want to travel to the drop-off site, the buses will be at those 5 complexes starting tomorrow at 10:20 in the morning. They will be there for 20 minutes, and then they will begin their route to deliver. This is an effort to try to make it more convenient for families to get meals. You do not have to bring your children outside. We're just asking that you tell the servers how many meals you need, and you will receive breakfast and lunch for the number of meals requested. For the families that we are delivering the food to your door, this is a knock and drop. We will ring the bell. We will knock on the door. If you cannot be home to receive these meals, again, we ask that you go to any of the locations that are listed. Our ESL and ELL liaisons are working with our families in Haitian Creole, Vietnamese, Portuguese, and Spanish. They are working with them to deal with all of the announcements that are coming out since school closures began. Over 95 families have been contacted and given services that they need. The schools are providing a list of students from the families of EL students who have not logged in the classrooms, and we are continuing to reach out to provide technical assistance and academic support. So if you have not heard from anyone or you feel like there are questions that you haven't answered, please reach out through email to the liaisons, and they can also be found on our website in the English Language Learner Department page. I'm understanding that people are looking for working papers. I would ask that you email the Family Resource Center. Their hours are very limited at this time. But again, if you go to our website, you can find the FRC email information, and they will make arrangements for you to get working papers. And then lastly, the deadline for senior scholarship applications has been extended until Thursday, April 2nd at 2:30. If things were to change and school not remain open, that time would also be extended, but stay tuned for further information and we will update that as soon as we get it. This is not just for RHS students, but for any Randolph residents in other surrounding schools. You can also mail in your packets or drop them off. There's a drop box at the FRC. If you do that, please include your name, the school that you attend, your address, phone number, and email information. And as always, please stay safe and be healthy. Thank you.
Thank you, Tia. 2 of the things that the governor talked about today, briefly, they didn't get too deep into the weeds on this, is they're expecting to extend the deadline for districts to submit their 3-year Student Opportunity Act plan, and they're having conversations about the modification or waiving of the MCAS testing requirement for this year's graduating classes. One of the other things that we get a lot of questions on, I'm sure you get it even more so, are they really going to be back to school the first week of April? And same thing with us as far as the emergency orders the governor placed in. We simply don't know.
Right.
We're anticipating that if it's going to get extended, they're going to give us at least 3 or 4 days heads up so that we can plan for it. Are you hearing anything through Mass Association of School Superintendents, or is the information pretty similar?
I think we're getting pretty similar information. We're hearing that there's a possible extension. Right now, the commissioner has talked about extending MCAS. He hasn't really talked about waiving it as much. We have another call later this week. I would think if schools were to open in April, he'll probably push back the MCAS requirement if it gets extended much beyond the beginning of April, because the window is supposed to open April 3rd. So if we get way past that window, then he would probably just waive, which would mean, because the questions I'm getting is, if my child doesn't take MCAS, what happens for graduation? I would assume that at this point, if they're going to waive it, then they're going to waive that requirement for graduation, and that there may be other pieces that get put in place, like a capstone or some sort of support. But right now, I'm hearing what you're hearing, that there's a possibility of extension with no real distinction. And I would assume if our numbers of COVID-19 are rising exponentially or whatever, that's going to be a huge determining factor of where they go.
And I think that's really what this comes down to, is there has been a very strong effort over the last week and a half to 2 weeks, and the governor just went further yesterday to see how much we can flatten the curve, and if the numbers are going in the right direction, you may see things go differently. But we don't have the data yet, so we have to wait this out. I know, to the parents at home, you want to be able to make plans, understand where things may stand 1 week, 2 week, 3 weeks from now. But we're operating on a day-to-day basis here. Literally, every day the governor speaks and there is a new situation that we're dealing with. During these emergency times, I know folks like to drop off food to the fire department and the police department and their show of support, but both departments are in complete lockdown for good reason. I'm going to go to you first, Chief Pace, for your update, and then over to Chief Donovan.
Well, like Mr. Howard just said, we do get a lot of people that want to support us with food or coffee or things like that, but we're not allowing that into the police station. We do appreciate your support, but at this time, because of the coronavirus, we're basically locked down. Our employees are required to have their temperatures taken before they come into a police station. The lobby is open to emergencies only. And I am pleased to report our call volume has gone down, which has been good. And I just want to reiterate that our service, the service that we provide, has not changed. The way that we fulfill the service we might have you call something in, like a minor report of identity theft. We can give you a case number. A lot of other things that we take reports on can be done over the phone. So if you think you'd like to come to the police station, please call us first. But obviously, if it's an emergency, the lobby is open to you. Again, we have increased patrols in the community, especially in our business areas. So again, we're handling it. Our call volume is down and things are going well.
Thank you, Chief. Chief Donovan, there's been a lot of talk on the news, a lot of talk at all levels of government about the need for protective gear for both police and fire. How are things going over at the Randolph Fire Department?
Sure. We've, obviously, that has been said many times in the media. We were lucky enough to have a cache of a large quantity that can get us through 2 or 3 weeks at least currently, but we also have found a source internationally that we're going to be able to have some equipment come in through. And we're also making alternative measures that will keep us out of this situation in the future, whereby we've made a significant investment in what's called a PAPA device, which is a powered air purifying respirator, which will allow our firefighters to be self-contained. We won't be relying on the N95 masks for part of our personnel when they're out there in the field. I would like to take this time, Mr. Howard, to commend the men and women of the fire department and the police department, as they've really, risen to the occasion as they have faced the issues and the dangers associated with the COVID-19 virus. With that said, we continue to adjust our standard operating guidelines to allow for our people to be given the best possible defense as it relates to equipment and action-based intelligence given to us by all federal, state, and local health officials and experts. And like I said earlier, although we have adequate supplies of personal protective equipment currently, we have been relentlessly seeking out supply sources nationally, internationally, and locally, and have received much help from our local businesses, as well as the Randolph Public School System through the assistance of Superintendent Stovall. I have also invested, as I said, significant resources in purchasing those air purifiers, which will help us to not be leveraged in the future. Just two more things. As Randolph Fire is the EMS transporting agency for the town of Randolph, we're asking all residents calling 911 for emergency assistance to please be as forthcoming as possible with all aspects of your current medical status, meaning, tell us what's going on, what's your baseline. This is all just to protect the first responders coming to your house for assistance. So that we can make the best the judgments that are going to keep our people safe and the best possible outcome for the people that we're assisting. We're also asking that if you are requesting medical assistance and you are physically able to do so, that's the key, please be at your door or outside of your residence while waiting for assistance so as to reduce as much as possible contamination to our public safety personnel. Thank you.
Thank you, Chief. And we can't stress that enough. I know we've tried to highlight it on the town's Facebook page, and you've heard me talk about this every instance that we've had one of these sessions is sign up for the town's email, sign up on the main website for the town on HyperReach, and sign up for Facebook. More than likely, if you're watching it now, you probably already have it, but if you're watching it with somebody and you don't have it, please friend the town's page. Every day we've been able to do some type of an update, and every few days we try and do one of these video updates. Liz LaRossi is our Director of Library, Recreation, and Community Programming. I know there's been a lot of things going on that end. If you could provide an update to the folks at home.
So both the RICC and Turner Free Library are closed to the public still, but staff are there manning computers for email and live chat and phones to field questions, as well as booking medical and grocery trips for seniors. We're there from 8:30 a.m. to 4:30 p.m. Monday through Friday. We are also extending our online chat hours. There's now an online chat widget on both websites, turnerfreelibrary.org and randolphicc.com. Feel free to just log in and ask us questions directly from the homepage of our websites. In regards to the Turner Free Library, a reminder, all materials are extended through April 27th, so please keep your checked out materials at home until we reopen. I have been checking the book drops every day and people are still returning their books, so please stop doing that. Virtual programming. This week's programs for the library are posted in our schedule on Facebook. We have digital story times Tuesday morning, Wednesday evening, and Thursday morning. Reiki live stream Tuesday and Thursday at 11:30. Canopy watch party Monday at 12. And craft tutorials on Friday afternoons. Stay tuned. We have some really fun ways to recycle some of your old books. We have a community crisis guide on the homepage of both the library and RICC websites. It gives updated info on local and state resources, such as Department of Health, unemployment, local grocery stores, how to get food, transportation, and more. The library has purchased a new database called Help Now. We have implemented this database to support distance learning for all ages. It includes homework help, skills building, personalized e-learning tools, 24-hour writing lab, homework send question feature, adult learning center, and foreign language lab. You can find this right on the main tab of our main website. We have library staff not only working on virtual programming, database procurement, and digital resource development, but they're also sewing masks, our more crafty staff anyways. They're not sewing masks for medical personnel, but for community volunteers, so for our van drivers and those that are not working with people who you need a mask for. The majority of questions we are fielding have to do with e-card registration and instructions on how to sign up for access to ebooks, movies, audiobooks, etc. digitally. Definitely check out our website for that info, turnerfreelibrary.org, and to find out what digital resources are available to you for free with your library card: books, magazines, movies, homework help, and more. And reach out with questions. In regards to Randolph community programs, a reminder, memberships to the RACC are being extended through this time of closure. Virtual programming. This week's schedule for the RACC is also posted to Facebook. We've got meditation, Zumba, Reiki, trivia, and lots of suggested family activities throughout the entire week. Thrive, Randolph's Financial Opportunity Center, has recently regained traction through some state funding, and our consultant has created a database of emergency financial resources for small businesses and individuals during this difficult time. The resources will be added to the Community Crisis Guide as well as posted to the Thrive and RACC websites this week. Public spaces. As Town Manager Howard mentioned, please use Powers Farm and other open public spaces responsibly, following social distancing protocol. The playground areas at Powers Farm and Imagination Station are closed to the public. All of our departments have been so great supporting our senior services, especially health, fire, and police in this time. Residents have reached out to volunteer. The Randolph Police Department has been delivering meals for our Meals on Wheels, and our local food pantry has been working with our amazing outreach worker, Jonathan, to ensure that our seniors have food at home. We were even able to send out some memory games to our homebound seniors, which was really fun. Those puzzles are available and printable on our Elder Services tab of our website, randolphicc.com. On top of all of these efforts, Town Manager Howard has created the Randolph Resiliency Committee. This committee consists of community partners that have a long history of assisting vulnerable populations. We will hold the first official meeting this Friday afternoon via Zoom conference, and we'll discuss our strengths as a collaborative and our needs as a community. We'll be looking for ways to help our vulnerable populations, such as food drives, clothing drives, senior check-ins, organizing volunteers, and more. We'll keep you posted on this one for when we do need those volunteers. If you have suggestions for this committee, please reach out via email to elarosi@ocln.org. Community feedback is vital to our efforts, and I welcome any and all ideas. Thank you.
Thank you. In reviewing just momentarily the Facebook Live feed, I think there's a little bit of confusion about MCAS, about graduation requirements, and by extension, some of the other things the governor talked about today. He is filing legislation today, which has been filed. It has to go through the state legislature before it goes to be enacted. So today, the governor talked about the MCAS. He talked about the extension of the timeframes for the filing by the school department on the Student Opportunity Act. He talked about the ability to sell alcohol by a restaurant during the delivery process. He also talked about a number of ideas that would be tremendously positive to us on the local level. You've heard me talk about the uncertainty that we've had with folks who have or are seeking special permits, so that a developer couldn't get something by constructive approval, meaning we weren't able to meet the deadline. Well, the governor, in his filing, one of the things that he's doing is putting in language that will protect municipalities, and that cannot occur. So we're very excited that is in the package. There's a few other things that are in the package. One of them are topics that President Burgess is going to mention, something that town councils have been reaching out to me about in regards to the water and sewer and excise tax bills. Jerry, just a follow-up on the key things people need to remember. I mean, we're talking about the social distancing. We're talking about, and that's really the key to this, is the social distancing. We're talking about the hand washing. We're talking about making sure that you don't touch your eyes, your nose, your mouth. What else do you want to add before we conclude in regards to the Board of Health? One of the things I'd like you to mention is the Medical Reserve Corps. They did provide some assistance to us over the past couple of weeks, but I do want you to mention that and folks who want to get involved specifically in that arena.
Sure. No, just to start out, you're absolutely right, Brian. Anybody can get COVID-19. We have to keep our guard up. We have to remember to follow those precautions. We want to wash our hands. We want to not touch our eyes, our nose, or our mouth. We want to use hand sanitizer if hand washing is not available. Cover your cough, cover your sneeze, and stay home if you don't feel well. And it's really the social distancing is key to all this. So as far as the Medical Reserve Corps, yes, they're a group of volunteers that may or may not have a medical background. For every one medical person, we find that we would need at least 3 non-medical folks to support the medical person. So this is really going to be important for us when we start to ramp up when the vaccine does become available months from now. But for right now, the Medical Reserve Corps has been helping us out by going out to the restaurants and checking on them for us to make sure that the restaurants have the social distancing practice in place. And I also want to thank the police for helping us with that as well. Some officers have come by and asked for tips and how they can help with enforcing the restaurant requirements. But I also want to emphasize to know when to get emergency help. So there are some specific warning signs that we should remember. So it's difficulty breathing, shortness of breath. It's a persistent pain or pressure on the chest. It's really upper respiratory in your chest. And any type of confusion. So the confusion is all new confusion, and what that is attributed to a lack of oxygen. And the bluish lips or the bluish face is also part of the lack of oxygen. So if you have those types of warning signs, that's something that you would want to call for emergency help. But as the chief mentioned, please, please, please remember to tell the 911 dispatch that you're experiencing some of these symptoms, just so that we can help protect all of our emergency responders.
Now, I know there have been questions about, I know there's one at South Shore in Weymouth at the Naval Base. They have the drive-through testing facilities. Mm-hmm. You still need to reach out to your primary care physician, and they would authorize you to go and get the test.
Right,
Is
it's
my
three
understanding.
it's
This is
three
not
primary
you make
care.
a decision for yourself that, geez, I think I meet some of these standards, I want to go get a test. You still have to go through certain channels so that they can be recorded appropriately and make sure that it's done correctly.
That's correct. At first, when this first rolled out, folks would need to get permission from the Mass Department of Public Health to have that test done, but now it's through their primary care physician, and so the primary care physician will really guide them through that process, so that we wouldn't have that information at the local health department level, not only here but across the state. So that's something that the primary care physician would make those arrangements of where and how people could get tested.
And if they don't have a primary care physician, they certainly can reach out to one of the area hospitals' emergency rooms. And again, you need to call first. They do not want people showing up
Correct.
with those health issues at play.
Another really good resource is the 211. It's just like dialing 411 or 911, but it's 211. It's that simple. And it's a great way to get information about COVID-19, and that's through the Mass Department of Public Health.
And speaking of that, the 211, they also today, the governor announced the ability to have text directly from the Department of Public Health and from the governor's office to your phone. You would text COVID Mass, COVIDMA, to 888-777. So you open up your text on your phone, you type in 888-777, and in the message, you type in COVID MA. I've done it right after the governor talked about it, signed right up, and we'll start getting those updates. And they said that they'd keep it to 1 or 2 a day. Their goal is not to inundate people with messages. To the town council president, I know one of the things the town council and members have been reaching out to me about consistently has been folks reaching out to them about their tax bill, whether it's their utility, whether it's their excise tax, and there is some information that we're able to provide today.
Yes, I'm Manager Howard. First, let me say, on behalf of the Town Council and the residents, I want to thank you and your team that you've put together to deal with this COVID-19 virus and what we're dealing with in the community. From all of the town employees, the professionalism has been unbelievable, and we appreciate that. On our utility bills, I know the council has talked to a number of residents, and I know through working with you and working with our finance staff, the utility bills, which are due March 25th, and the excise tax bills, which are due March 27th, we will extend those, working with the town manager, 30 days. We do, though, encourage people to pay if they can pay. Having our people out, our fire and our police and all of our emergency services, that still costs us money, so we still encourage you to pay if you can pay, but those bills will be extended 30 days. And we will be considering other avenues as we go, if this continues. So that's important. Your town council continues to operate. We still continue to function. There was a hearing scheduled last Monday. That was administratively opened and continued, as well as I appointed a town charter review committee today, and they will be getting their packets of information to start their work independently of reviewing the town charter. So your council continues to operate, continues to function. We will keep you informed as we move forward with any Zoom meetings or how we will let the public participate in those meetings remotely. And again, I can't thank and I can't say enough of our department and our department heads here, superintendent, chiefs, Mr. Cody, Liz, everyone. We appreciate the hard work that has happened and continues to happen.
Thank you. To the folks at home, we will provide daily updates on the website. We have done multiple of these live Facebook and RCTV. I do want to thank RCTV for continuing to work with us during this time frame. As I mentioned at the last meeting, please, Randolph is a percentage point ahead of the state average right now in answering the 2020 federal census. As I talked about at the last meeting, when people say, well, why do I need to answer my federal census? Because that data is going to be used as the federal government releases billions of dollars of aid to the communities. So please, go online, answer your federal census. It is critically important. We are going to do another piece about that in the next few days, but please, my2020census.gov, answer your 2020 census. To the folks at home, we'll be updating some of the key points on our town's website and on Facebook, so anybody who may have missed part of this, you can also click on the video on both RCTV streaming website and on Facebook. And please, be well, folks. We're a few weeks into this, and we're still at least 2 to 3 weeks before we kind of possibly get our some sense of normalcy back. So be kind to each other, check on your neighbors, especially neighbors that are senior citizens, and if we can be of assistance, reach out to us. Thank you.